This is Dr. Shirlea North from North Star Physical Therapy. Thank you for all those listening. I just need to have a quick shout out to all of the listeners over the last year change. We just celebrated our milestone on this podcast of having 2,500 downloads. So if you are one of them, or if you're new to us, welcome and thank you. Please share, subscribe this podcast. My whole point is to just spread appropriate and digestible medical knowledge within pelvic health and lymphatic health for everyone, no matter the gender, sexual orientation, anything like that. It's just the tip of the iceberg, so that way you are educated and empowered to go to your medical providers and advocate for yourself and make sure you're on the right track. I just thank you for all those that have listened to this podcast and for all those that have shared it. And again, welcome to the new ones. So this podcast is a little bit more than just like awareness episode, where we are recording this for September. I can't believe it's already September this year. This year has just flown by so fast. But September is a very unique month, especially within my specialty within physical therapy. As you guys now know, I specialize with pelvic health and with lymphatic health. And there are sometimes these awareness months, like breast cancer awareness is in October, so be on the lookout for that one. Prostate cancer with the November stuff for those with prostates in November. So there are these certain months that really call upon certain medical awarenesses. And September is really unique because September has both of mine. We have National Ovarian Cancer Month and National Lymphoma Awareness Month. So both of these conditions overlap my two specialties. And it is just so important to be in tune with your body, to be also advocating for your health, whether it be physically, mentally, behavioral health as well. But both of these conditions, ovarian cancer and lymphoma, come with symptoms that may be masking or may be confused with something else, but it really does require us to really tap into our body and say, you know what, something's off, or is this normal? It is okay to go to a provider to just ask, these are my symptoms, is this normal, or can we get further diagnostics done or something like that? The best clients are those that self-advocate. And I have absolutely no problem with, if a client comes to me, I'd rather them come to me to ask those kind of questions, because I know evidence-based practice, we know how to apply it to the person, but does that person really know, yeah, I shouldn't just let these symptoms go, I need to go get it checked out. Like, we should not be afraid of the medical community anymore. We need to be working with and in tandem with. You know, it's very generational for those in the more experienced population to just go with whatever the doctor tells them. There's then been a generational shift of, I know more because I have access with Google and WebMD and all that stuff. But do you know how to apply it to your own body? Can you step outside of yourself and look in? And that's what a healthcare professional should be working with you on, collaborating with you. So let's start with the first one. It's National Ovarian Cancer Month. Nobody wants to be diagnosed with cancer, let alone ovarian cancer, which is a sexual reproductive organ for fertility for those with ovaries. And I'm going to generalize and say women, even though I'm very inclusive, but just general terminology, yes, women have ovaries, and that can be really debilitating. It can be really hard to get an ovarian cancer diagnosis. And some of those symptoms could be masked for, it's just ovulation pain, it's endo, but it's always going to be like, you know what, this isn't normal. A normal period should not be lasting this long, should not be this heavy, should not be this painful. If I have a client who has a very heavy flow or is extremely painful that they have to take more than one pain medicine or one dose of it to alleviate their symptoms, that's not normal. So we also need to stop gaslighting our clients and saying, that's just normal, it's just period, pain, whatever, and deal with it. So no, there's something off. This client is coming to you, practitioners, so we need to work together. Yeah, ovarian cancer is very debilitating. So we're not going to be talking about necessarily the treatment of, that's beyond my scope of practice as a physical therapist. What is within my scope is to help with those symptoms of the treatments. So within any cancer diagnosis, but especially within the pelvis, we can have chemo, radiation, there may be therapies as well. And so I work a lot with the medical team to say, okay, we have this global pain going on, or there might be some constipation, or there might be some fibrosis happening in the tissue, or there might be some swelling because the lymph nodes are involved. Okay, so being within the pelvic region, the lymphatic system is there as well. The lymphatic system is what's mainly, not only besides the organ, but the lymphatic system is really an overdrive to help kill this cancer, but it can also spread to those lymph nodes, then really infiltrate and be sinister like that. So I work a lot with oncologists, a lot with vascular medicine and primary cares and all the people that's involved with your care so that we can help reduce those symptoms as much as possible from the treatment of cancer. You are a cancer survivor. We want to keep it that way, but we want the quality of life to also carry forward. So with those with any kind of pelvic cancers like that, we have to be paired up with a lymphedema therapist as well as a pelvic health therapist. And that's what's unique for me is that I'm both, right? So we're able to work on lymphatic drainage. We're able to work on that muscle pump actually to decongest that area of any kind of swelling because there's been structural changes from the effects of the treatment or lymph node removal or things like that. But then we also want to look at the quality of life for being able to pee, to poop, and to have sexual function within that individual as well. So we're looking at that as well. Ovarian Cancer Month, I want to say definitely be an advocate for yourselves. Get checked out, especially if it runs in your family or if periods or ovulation is just off and you just want to get some further workup done. You have the right to do that and you should advocate for yourself for that. For Ovarian Cancer Month, not only should we be diagnosed and be checking in ourselves, but also for those that have been formally diagnosed and those going through treatment, I highly recommend you get connected with a lymphedema therapist and a pelvic health therapist, just because especially in the location of the cancer, we don't want quality of life to reduce at all. We want it to increase, and we don't want you to be limited because there are pelvic health symptoms that crept in, and that's what's limiting your life. So definitely make sure you hook in with both kinds of therapists for that. My next awareness feature for the month of September is Lymphoma Awareness Month. So I've just been preaching about the lymphatic system. Here you go. These are individuals that have the lymphatic system itself is the originator of these cancer cells, and it can be extremely difficult, can have a lot of side effects to that because of just how important the lymphatic system is. The lymphatic system works hand in hand and in conjunction with the cardiovascular system and with the immune system. And so just structurally, the lymphatics run right next to and intertwine with the veins. They also are the filter station for the immune system. So let's say you get an infection, no matter what, right? You get an infection. The immune system goes and floods it with a bunch of fluid and nutrition to say, kill this infection. What is this bug? Get it out of here. And your body is working. The lymphatic system goes right behind there and says, okay, whatever isn't being used right now, we're going to recycle and we're going to get rid of. So it decongests that area. So if you have this immune system that's just fighting, or that's been compromised because of treatments or medications, you can now see how the lymphatic system gets got all cattywampus and all, wait, what are we doing here? Or for those with any kind of cardiovascular things too, we often shove a pill in there for a diuretic to get the fluid flowing. There you go. But then if that fluid is still stuck in an extremity, we got to get that fluid moving to where it needs to go, and then you can get rid of it. The lymphatic system is quite an amazing system that really is intertwined with everything, and it's everywhere. It's in your arms, it's in your legs, it's in your face, it's on your head, it's in your trunk, it's in your pelvis, it's in your legs, it's everywhere. And so for those lymphedema therapists that only treat those after breast cancer, definitely needed for sure, but that's just one extremity. What about the rest of the trunk? What about the rest of the abdomen? What about the neck? What about the face? What about the legs? What about the pelvis? So for here at North Star Physical Therapy, I don't care where it is, we're going to treat it. And we're not limited by just one extremity or one half an extremity to work on one half of the body. So we work on all of it because that's how the body works. We go by the anatomy. So within these awareness months, especially for lymphoma, I have a personal connection with that. And we have to make sure, again, we listen to our body. If we have some swelling and you've been put on a medication and it did nothing, you just feel really fatigued or really off or in a lot of pain, to get that checked out, not only for diagnostically through CT scans and blood work and maybe an MRI potentially, but also for a lymphedema therapist to get connected there so that when we can help that system kind of reroute a little bit, help decongest that, and then help keep that away through good maintenance tools. I just really have hold near and dear to my heart these awareness months in September here with ovarian cancer and lymphoma awareness. It can be a very debilitating thing. It can also happen like in tandem. And so the importance is the collaboration within the medical team, with having the right therapists on board for lymphedema or lipedema, or for lymphoma, anything with lymphoma, right? You want to have a lymphedema therapist on board, and you want to have somebody that has a CLT behind their name as well, because those are certified lymphedema therapists. They can be PTs, they can be OTs, they can be massage therapists but lymphatic massage and manual lymphatic drainage are two different techniques. Look up my other podcast to get a little bit more into that. But you want to have somebody that knows what they're doing, that has CLT behind their name, or LANA, CLT LANA behind their name as well. Those are two big credentialing boards within the lymphatic world for rehabilitative providers. So you want to make sure that's on board here for any kind of cancer diagnosis, but especially these two, as well as a pelvic health PT to also screen out any potential pelvic health symptoms brewing from the treatment side effects, as well as being able to really make sure that the exit for this lymphatic system, which is your urethra, can be addressed if there's any kind of previous issue going on that may be common but not normal. We want to make sure we're normalizing that system as well. Please feel free, y'all, to message me, DM me, look me up, send me an email if you have any questions, or to connect with a virtual consultation with me. I'm more than happy to help continue this conversation going, get a little more detail for maybe some more individualized considerations for you. But September is an amazing awareness month for a lot of medical conditions. I just wanted to highlight these two because they overlap within my specialty, and it is so important to include a lymphedema therapist and a pelvic health therapist within your care or your loved one's care to really treat holistically and for that quality of life. All right, and until next time.